as you can see, I'm from the University of Sydney, but this was done in collaboration with people from the Australian National University, particularly they were still at the Menzies Centre there and the Australian Primary Healthcare Research Institute. So there was a strong primary care element to it. We've done several of these since 2008 when we did our first one with the national surveys. We used a sample of 1,200 respondents, which is the sort of normal size you get used for this sort of thing, and you get about a 3% possible error rate within that. So any of the results, you sort of go up and down 3% to see the range within it. And it used this digital computer-assisted telephone interviewing. That's actually not one of our interviewers. I hope they were as happy as that. It's a way of, you see a lot of this sort of survey being done, it's becoming a little bit problematic because so many people don't have telephones, and you actually get a bias in your surveys. You tend to get older women responding. Either they're more likely to answer the phone, they're often protecting their menfolk, and they're more likely to want to talk about a healthcare survey, whereas men are unlikely to. And when you get to results, looking at results like young blue-collar males, I tend not to dig into that level of the survey because I'm assuming any young blue-collar male who does a 15-minute survey on the health system probably is not typical of their age group, and we're going to get some very strange results. But anyway, it tends to still average out, and they now do some mobile phone interviewing as well to supplement it and to get at a younger demographic. It's all weighted using sort of balanced against the age and location of the population. So we had a whole series of questions. We've got really three main things we look at. It's an opinion survey, so we've got no way of knowing whether they're lying through their teeth, as they're just talking over the phone. So the assumption of this sort of survey is that what you're getting are people's perceptions of what's going on. You use other sorts of research, and there's a lot of that. The Australian Bureau of Statistics does a lot of more detailed research that can get, and the census on much larger populations, and there are other methods for actually finding out whether people are healthy or not, like taking blood samples and things like that. So it's really, what are people thinking about the health system? And we had a section in this survey, which I won't have time to go into, on aged care services, which we've done for the last two. All of this is up on a website if you want to look at detailed results, or if you contact me, I can send you information. So we are breaking things down by age, the location. Again, with that sort of survey, you can really only get capital city and non-capital city. You could do a little bit on the larger states, but once you get down to the smaller ones, the sample size falls so much that your level of error rises, and so you can't say terribly much about it. Level of education, and one that we found most interesting, which we've run across the three surveys, was on financial stress, and that's looking at people are asked whether they have trouble paying their bills, and whether they're asking their family for assistance, whether they've had trouble paying, keeping up with credit card payments, and we've got a composite measure from that. And so the first result here, my printer broke, so I've got to read this off the crane around, but the first one was, how do Australians rate their health? And you can see there's a strong link between education and health. though people with high school education rank their health higher than people with trade or vocation. But you can see there, having a university education means your self-rated health is much higher, and that fits with a lot of else that we've found. You can see there the education one broken down over 3 years, and you can see it's consistent across those 3 surveys that the higher your education, the better your health self-rating. We then moved to ask how confident people felt about receiving good medical care. This is a question that's been asked across a lot of countries, and Australia tends to rank fairly high. And you can see it's very consistent across 3 surveys, which means we're fairly confident that we're picking up something here, and that Australians, when they're asked, are very confident of most aspects, except it falls a bit when you come to affordability. But the other aspects, medication, medical technology, and quality and safety, people's perception at least, is that the system is working very well. And it's a finding that comes out quite a lot, and it wasn't actually what we were expecting, because newspapers are so full of a dysfunctional, collapsing health system. And what we found were people who were, and particularly when we dug into and worked out whether they were actually using the health system recently, those people's level of satisfaction tended to be higher than people who weren't using it, who presumably were getting a lot of their information from tabloid newspapers and the wilder end of radio, and were hearing about crisis, people dying in waiting rooms of hospitals and that sort of thing, and people's perception of their own care was much higher. You can see there it runs right across, and there's not much difference between capital cities and other areas, which was another one that was surprising. One thing that we think with that one, though, from some other results, is that with people outside capital cities, it's talking about the care they received. It's not necessarily whether they think they're going to receive care. There are greater problems there. You can see here, though, our general confidence in the system starts to fall. It's still pretty high, but financial stress is hitting, and that last one, being able to afford the care you need, it's falling quite rapidly with financial. Yeah.
What about health insurance? Does that skew any of these findings?
The first survey we went into health insurance. It was difficult to tie in, partly because health insurance covers different parts of the health system, and it was quite difficult to get questions for a general population survey that dug into that level of whether your health insurance was helping you. I think it's probably something we should go back to, and because then it was more how affordable was health insurance and did you want it? And we found a lot of people had dropped out of it because of affordability and would prefer to have it if they could afford it then. That was 2008, and we haven't tackled that one again. We've only got 15 minutes or 10 to 15 minutes, so we have to be incredibly parsimonious on what we can ask. There's an awful lot I'd like to ask, which we just, when we time up, it just has to drop out. Okay, how much do people use the health system and how satisfied are they? Now we've done this over, again on the full thing, it's over about 12 different areas of the health system, but I've picked out some of the, I suppose, the 2 strongest bits at either end, and you can see there general practitioner services, 94% of people use them in the last, I think the question's the last year, and that fits with other statistics we have, and 78% of them were happy. and pharmacy. Again, this is something that's picked up regularly in surveys. I think we might try to go into that a bit further in future because we're not sure whether... It is a health service question, so we're hoping they're referring to the health services and not the other things that pharmacies do. And at the other end, you've got very low use of mental health providers, which means that there's a problem of we've got very low numbers there, but the lowest level of satisfaction of any service comes with mental health, and actually aged care wasn't much higher than that. And dentist was interesting. That's actually low use rather than it's a high level of satisfaction, but again, I think if you dig into the people with financial stress, you find they're not using dentistry very much, and that's really a major problem in our system. And we did ask in this last one about nurses working in general practice, and we found there that they're up with GPs. It's about 90%, I think, satisfaction there. We didn't try digging any further because when you've got that level of satisfaction, you just find it doesn't matter which group you break it down to, they're all happy. So I can't tell you who the 0.1% who are not entirely happy, either 0.1 or 0.9, but it was less than 1% were not at all satisfied. And again, we phrased the question to try to make it as clear that it was a nurse working in general practice, because one of our worries there was that patients wouldn't know that when they go into a doctor's surgery, they know who the GP is, but there are all these other people, and which one is a nurse and which one's a receptionist could be confusing. I think we broke it down enough so we can be confident it's at least nurses or people who appear to be nurses who are doing medical things in general practice. So that's an encouraging thing. And in an earlier survey, we asked about how likely people were to use nurse practitioner clinics without general practitioners there. And we listed some of the things that one that was going, I don't know, I think it opened in the ACT was going to do. And we found sort of 90% said they would use it. It was particularly said if it could be done at the same cost, which wasn't the case, and particularly if you didn't have to wait as long. So sticking with, just looking at the health system as a whole, this is a question that's been asked over many years by the Commonwealth Fund in New York across about 10 countries. Australia always comes sort of at the slightly better end. It's really a question saying, is everything so bad we should blow it up and start all over again, down to just needs minor changes. There isn't an option of saying everything's so perfect, I don't think it needs anything done to it. And one thing that was quite striking there was that over that time, satisfaction has risen. And again, that surprised us. We thought they'd be a bit all over the place or even getting worse. And again, that's something I think our next survey we're going to dig into further and see if that maintains itself, what it is that people are seeing as better. But again, it's a better view of what's going on in the health system than a lot of what you get in the media. And if you break it up by region, you'll find there people in capital cities are much happier. And that pattern was true across all three surveys. So whatever it is, the improvement is not even across the country. And that capital city, these are statistical divisions, which are a bit funny because the capital city doesn't actually include the outer metropolitan areas. So this isn't a rural-urban one, it's outer metropolitan, provincial cities and rural. So it's everywhere outside of the old sort of concentration of medical services in the inner cities. And I think it comes out, it's probably not surprising that that's there, but it is quite a significant finding. So finally, I'll look a bit at some of the other primary care questions we asked. One of them was about use of general practice, and we found there that, and this is according to age, the older people got, the more likely they were to go to the same practice and always seeing the same doctor. I think that was an interesting and encouraging finding. We actually took a similar finding from an earlier survey and did one of my colleagues who is a whiz at statistical modelling and things, did some modelling using information about these people's health status and various other indicators. And what we found there was the more likely you were to need a regular GP, the more likely you were to be seeing a regular one. In fact, we ended up concluding that we've almost got registration for the people who need it at the moment. The younger you were, the more likely you were to jump practices, and the healthier you were, the more likely you were. And also people who went a lot to the GP. Yeah. Yeah. Yep, we haven't been able to build that in, but I mean the level of bulk billing services is very high now, so I think yeah, it would be an interesting question, and it's an interesting question about whether people are telling the truth all the time. I think some feel guilty if they go to, yep.
I'm just wondering if there were any distinction of cultural difference between people who consistently attended a GP and those who didn't. It's just in recent work that we've done.
Yeah.
It's been identified that a particular population would be less likely to consistently consult the same GP, and I'm just wondering if that was something that you learned.
I think that would be something you couldn't research with this sort of method, because we did ask about speaking English at home or the place of birth, but the numbers you pick up is particularly, I mean again, it's part of the clunky nature of this sort of overall picture, that you're calling people on the phone and you're not using translators. So you're only going to get people who are confident enough of their English for a start to do a 10-minute phone interview. So you've automatically excluded a whole lot of people. So there's a problem, and the results like this need to be read with those sort of consumer warnings. We're getting a picture. It's probably a picture of the majority community. It's not very good at picking up minorities, so it certainly shouldn't be used to say everybody is happy with the system, so let's not worry about it. It may be saying most people are quite happy, are getting these services, so if there are problems we should be looking, our research should be focusing on minorities and diversity rather than on one-size-fits-all services. So I've just got a few to go, but you can see there the waiting times, and you can see that people who go to different practices don't have to wait as long, which isn't terribly surprising, and people who always go to the same practice are prepared to wait to go to it. Sometimes more than 5 days. And how easy is it to get GP care outside normal business hours. This was one that surprised us a bit because there was a significant change there, improvement. The first figure is the most recent. And it would be interesting to work out whether telephone services are making a difference there, and that would be one thing we would be interested in following. So some of this is just to throw up questions that can really be resolved. This is the last slide. And we asked a general question. We actually, on the first survey, we had an open-ended question, just said, when you talk about the health system, after being asked whether you thought it was good or bad or should be blown up, what do you mean by the health system? And there was an open-ended question which we then coded, and in this one we gave them multiple choices according to the codings we'd found were most important. And you can see there, more doctors, nurses and other health workers comes out with 50% there, and cost of care coming behind, but as very significant. And then there's a big jump down to access to care, which is that 15%, and listening to patients more, which I suppose gets us to the theme of this session. So I'll leave that there, and I think these slides are provided afterwards, so if you want to access it. And, oops. I thought I was told that should jump to the...
I'll leave it, that's fine. Thank you so much for that.